Hi, I'm Dr. Esra Shermadou. I'm a board-certified family medicine physician. And in this video, we're going to talk about one of the most common concerns men face as they get older. That is erectile dysfunction. Despite how common it is, it's still one of the least talked about issues. Over 50% of men over 50 will experience some degree of ED, and that risk increases by about 10% with every decade. Even more important, erectile dysfunction shares many of the same risk factors as heart disease, and it can actually be one of the first signs of cardiovascular disease. Rather than viewing it as a performance issue, erectile dysfunction can often point to an underlying medical problem. In this video, we'll take a look at what causes ED and the treatment options that can truly make a difference. So, what exactly is erectile dysfunction? Erectile dysfunction is defined as the difficulty in getting or maintaining an erection firm enough for sexual penetration and satisfaction. It can happen at any age, but it becomes more likely with increasing age and with certain health conditions. What's important to understand is that ED usually isn't about desire or attraction. It's often tied to physical symptoms like blood flow, hormones, and nerve signals. And when things aren't working properly, anxiety and performance pressure can creep in, making that problem even bigger. Before we dive into causes, let's review some basic anatomy and what actually happens during a normal erection. So, the penis has three main cylindrical structures. On top, there are two larger chambers called the corpora cavernosa, and these are the main erectile tissues that fill with blood during an erection. Below that is a single smaller chamber called the corpus spongiosum, which surrounds the urethra, which is the tube that carries urine and semen out. All three chambers are made of soft sponge-like tissue that can hold blood. Nerves and blood vessels run through the tissue, helping create and maintain an erection. A healthy erection starts with stimulation. This can be physical touch, visual input, or even a thought. That stimulation then triggers a signal from the brain, which travels down the spinal cord and out through pelvic nerves. These nerves tell the blood vessels in the penis to dilate or enlarge, allowing more blood to flow in. As more blood flows in, the spongy chambers fill and the penis becomes firm. At that same time, veins that would normally let the blood flow out are compressed, which helps maintain the erection. After orgasm or when arousal ends, blood flows out of the penis and the penis returns to its resting state. Even though it happens quickly, this process depends on good blood flow, healthy nerves, balanced hormones, and mental focus. If one of those systems is off, erections can become difficult, resulting in erectile dysfunction. Many things can contribute to ED. Age is the strongest predictor, like we said, but other major causes include vascular issues, which account for 40% of ED cases. High blood pressure, diabetes, and hardening of the arteries or atherosclerosis can all reduce blood flow into the penis. Diabetes alone contributes to 30% of ED cases, affecting both blood vessels and nerves. Problems with the venous system of the penis, like leaky veins, allows blood to flow out too quickly, which can cause problems developing or maintaining an erection. Nerve-related issues like neurological disorders like Parkinson's, multiple sclerosis, or spinal cord injury can cause ED as well. Nerve damage from long-standing diabetes is another major contributor. Hormonal imbalances like testosterone or thyroid disease are less common, but still worth checking. Medications, especially antidepressants, blood pressure medications, and opioids account for about 15% of ED cases. And lifestyle factors like smoking, alcohol, inactivity can all play a role too. And of course, psychological factors including anxiety, depression, or unresolved trauma. These can be the primary cause, or they can make ED worse when combined with other issues. Often, it's not just one cause, but a combination. Evaluation of ED usually starts with a conversation, your medical history, sexual health history, and medication review. Blood work often includes a fasting glucose or A1C and lipid panel to look for signs of diabetes or other metabolic disorders, and hormone levels like testosterone and TSH. There are also brief screening questionnaires to assess how ED is affecting your quality of life. Treatment depends on what's driving the problem, and the best results come from addressing the full picture. Common approaches include lifestyle changes like exercise, quitting smoking, reducing alcohol intake, managing weight, and improving sleep. Oral medications like Viagra and Cialis are also effective. These help increase blood flow into the penis. Other medical options include injections like alprazolam, vacuum erection devices, and testosterone therapy if low levels are a clear factor. Shockwave therapy is a new therapy. It's still experimental. It may help with mild to moderate ED caused by vascular issues. It involves multiple treatments and may require maintenance, though we still don't know how often or how long. Sex therapy or counseling. This is very useful when anxiety or relationship stress plays a role. And surgical implants. These are a great option when other treatments haven't worked and satisfaction rate is actually high with these. There are also other experimental therapies being studied, including PRP, stem cells, and Botox injections, but these are still under investigation. The key is identifying your root cause and building a plan around it. All right, I know we covered a lot, but I hope this gave you a better understanding of what's behind ED and what can be done about it. Erectile dysfunction isn't about attraction or desire. It's often tied to physical symptoms like blood flow, hormones, and nerves. Addressing it early doesn't just improve your sexual health, it can protect your long-term health too. When you understand the cause, ED becomes something manageable, not something to hide from. With the right tools, the right support, and the right plan, real improvement is possible. All right, that's it for now. Make sure to like and subscribe and share this video with a friend who may benefit. Let me know if you have any questions in the comments and I'll be sure to address them in future videos.